Okay, so we are recording. It's Dr. Scott Geller, laser floater guy in Florida, and we have a great patient from Ontario. You're near Buffalo, did you say?
Yeah, we're between Niagara Falls and Toronto.
Yeah,
Yeah.
near Buffalo. And you had a posterior vitreous separation how long ago?
4 years ago. Yeah.
And since that time, what were your symptoms?
Since that time, I was seeing a lot of floaters, a lot of haziness, a lot of cloudiness.
Mm-hmm.
It was getting very difficult to concentrate. They were always in the way.
Okay.
So, yeah,
And you went to several ophthalmologists, right?
I went to my optometrist first, and he sent me to 2 ophthalmologists who both said, you have to learn to live with it. There's nothing that we can do. I thought that wasn't a very good response, so I kept doing research for 4 years, and then I found Dr. Scott Geller on the computer, and I thought, he's my answer.
Yeah. So they didn't offer vitrectomy or anything like that, did they? Or they mentioned it, but they...
He mentioned it, but he highly advised against it due to the complications that could happen.
Yeah, and indeed that's true. So you took a leap of faith. You came down here, which is great. And I'm probably the most experienced in this anywhere. And I like doing it. It's a challenge for me. Yeah. So actually, here's a video of what we did initially. You had there's the edge of the vitreous there, and you had that hyaline opacity that's off to the side. But that wasn't the only thing. You had a little cloud that popped up every now and then. Mm-hmm. Yeah. That's true. And yours weren't the densest, that I've ever dealt with. But, everybody's perception's a little different on these things for whatever reason. And I did the first laser session was fairly dramatic, you say, and
Yep.
The second one incrementally was a little less.
Yep.
And we did 4. I just went after a few little spots. Yep. You always have to go after the that's a hyaline opacity, so you always have to go after a little debris that might escape. But we got it, right?
We did, yes.
And I hope you showed the video to your ophthalmologist. Didn't your ophthalmologist, you sent him a letter and he said...
Yes, he refused to sign the papers.
Right. But, it's unfortunate that they just don't pick up a phone, and say, hey, I have a patient here, talked about what you're doing. What are you doing? How do you do it? Does it work? Does it not work? Yeah. Well, obviously it works. You got to ask the patient. This is not a placebo effect. Right. and maybe if you tell them your experience, it might help the next person.
That's right. That's the goal too, right?
All right. So have a safe trip back. Enjoy yourselves.
And thank you so much for all that you've done.
My pleasure.